Dr. Castelein with Brighton Foot and Ankle, and today we're going to talk about one of our big things that we see in the office, plantar fasciitis. This is one of the more common things that we see in our office, with at least 10% of the general population between 25 and 60 being affected by plantar fasciitis. So if you haven't had plantar fasciitis, I'm sure someone that you know has had it. And a lot of times we get, what is plantar fasciitis? Well, the plantar fascia is this big band that's on the bottom portion of the foot. We have our little foot model here, and what we look to say is this plantar fascia is this big band here on the underside of the foot. The fascia isn't quite a tendon, it isn't quite a ligament, but it's this big firm structure on the bottom aspect of the foot. I like to relate to it as being like a bow and arrow. If you can picture like the wood portion of the bow as being the bone structure that has a nice little arch to it, well, that plantar fascia is going to be the bowstring. And what this is going to do is it's going to provide tension to help us maintain that arch of the foot. And what happens in plantar fasciitis is we get too much tugging and pulling, we get an overuse of that band on the bottom portion of the foot. This typically causes pain and inflammation where the plantar fascia inserts into the heel. So when patients come and talk to us in the office, they're typically going to say that they have pain first couple steps out of bed in the morning, they're going to have pain after they've been at rest and they're getting up out of their chair, or if they're driving for a little distance and getting out of their car. Pain is typically going to be centered right here onto the bottom aspect of the foot. It's going to feel like it's sharp and stabbing kind of pain in that area. When we treat plantar fasciitis, we like to take a three-step approach to it. This is based on literature, and 90% of patients get better with these conservative treatments. It's funny to think though that plantar fasciitis doesn't just start, and our treatments can't just start with that band on the bottom portion of the foot. We have to come back here where the Achilles tendon is and where these calf muscles are on Audrey up here, and we've got to work hard on the calf muscles. We want these calf muscles to be nice and long, not necessarily focus too much on strength, but we care about the length of these muscles. This helps take pressure off of that plantar fascia on the bottom side of the foot. So in our office, what we like to do is we like to talk about stretching exercises as being the most important thing. We want to do not only just stretching exercises up here for the calf muscles, but we want to do some massage. We want to make sure that these muscles are nice, soft, and long. The second thing that we always talk about here in the office is putting something supportive into the foot. We want to bring something like a good orthotic, something that is nice and stable, that doesn't bend, that doesn't move for us. And this is the important part of an orthotic. Sometimes the orthotics get dressed up into a whole apparatus that gets put into the shoe. But we care about this firm support that comes in through here to help stabilize the foot and take pressure off of that plantar fascia. The last thing that we do to help improve pain quickly is we typically give some anti-inflammatory medications. That can be something oral or it can be something local into the foot to help relieve that pain a bit quicker. And it's those three things that we use here, and of course physical therapy, if we need it. There's other physical therapy techniques that can be used too. But those are the three things that we use here to help stop plantar fasciitis.